Okay, as part of my PhD, I have done several studies. The prime focus was to design, implement, and assess the effect of food hygiene intervention to see whether intervention has an effect on improving mothers' food hygiene behavior as a primary outcome, and to see whether intervention has an effect on reducing the level of contamination in food as a secondary outcomes. I also assess the sectoral policy to see whether food hygiene can actually be integrated in health, WAS, and nutrition sector. So I had several research questions. So in order to answer all of these, I did a systematic search at the beginning to understand what are the evidence gap in the sector, and then followed it by I did a formative research in order to understand some of the behavioral determinants and some of the motives, barriers for people to perform food hygiene behaviors. And after that, I sort of designed a curative intervention through a curative process. That means working with a multidisciplinary team to design an innovative package, and then implement it through a novel approach. In order to assess the effect of that intervention, I run a cluster randomized before-after trial to assess the effect of the intervention. From the main intervention study, the cluster randomized before and after trial, so I have concluded that the systematic approach using emotional driver and disturbing behavioral sense settings can actually alter multiple food hygiene behaviors. And the intervention which I have designed was effective in terms of improving behaviors and reducing the level of contamination in food. And the effect was measured 6 weeks after running the 3 months intervention trial. So the proportion of mothers practicing food hygiene behaviors were around 42% in intervention group as compared to control group remained the same, 2%. So the difference of differences was around 42%, the significant improvement in food hygiene. At the same time, the level of microbiological contamination in food was reduced from 3 log to 2 log in the intervention group, which was also significantly low during feeding. So the intervention was effective. So that was main findings from the intervention trial. Apart from that, from the literature review, the systematic search, there was very minimal evidence to demonstrate the evidence base around food hygiene. There are very limited intervention studies on food hygiene intervention. So this was actually the first intervention, the community-based food hygiene intervention trial run in rural settings using emotions and innovations basically. And then the final research questions was around whether or not the food hygiene intervention can actually be integrated into WAS, health and nutrition sector. So after doing the policy analysis and sector context analysis and doing a key informant interviews and also assessing the policy, what I have found that the food hygiene can be integrated. This is in fact a missed opportunity currently in the sector in order to improve the public health, the benefits of the people, because if you look at it in the sector, we promote hand washing, but what happens if people are still contaminating the contaminated food? So they need to do both, right? They need to, the food has to be safe and they need to wash their hands before eating. I was able to design an effective intervention, the simple but scalable intervention. That was one. The second is, of course, I have introduced multiple food hygiene behaviors. This is the first time we use emotions and disturbing settings concept in order to change multiple behaviors. So that was also effective. So my conclusion is we can actually alter multiple food hygiene behaviors using emotions and disturbing settings. That's second. The third contribution is, of course, the overall the intervention was effective. Then I can conclude that an intervention can actually be scaled, but the effect of that intervention at a scale yet to be generalized. Though we need to see whether the similar effect will happen in other settings. But from the efficacy trial that I have run has a huge impact. Finally, the major contribution to the sector is the intervention itself. So the sector stakeholders who is now able to use same food hygiene intervention and implement for behavior change through WAS, health and nutrition sector. I'm really proud of being innovative and creative in changing people's behavior. You know, that was one of my desire to run a cluster randomized trial as part of my PhD, because the behavior change happens through innovations and creativity, not by using a cognition model of behavior change. We know the posters, pamphlets, and caps and t-shirt is not going to change people's behavior. For me, the challenge was to design an effective intervention using emotions, using surprise, using creative intervention. So what I did was basically working with the creative team. I came up with the ideal intervention package that has an inspirational desire to become the ideal mother. There was a huge efforts on disturbing social settings. You know, without disturbing settings, it's highly unlikely that we'll be able to change people's behavior, both physical and social settings. Those elements were actually built in the interventions, and the intervention was actually rolled out to do that. So I was really proud of being able to design that effective intervention. That's first. The second one is of course, in the sector, as I said earlier, there was a very limited focus on food hygiene. So after my research and the outcome, when I started sharing to the sector, there is a growing recognition and growing demand on including food hygiene as part of the ongoing hygiene promotion in the sector. That's the second contribution. The third contribution, the trial was run in Nepal, and Nepal government, once I completed, and I have shared the findings with the Nepal government, and Nepal government, when later they decided to introduce hygiene through routine vaccination program in Nepal, which is currently the collaboration between WaterAid and Ministry of Health in Nepal. They are actually integrating hygiene into vaccination program in 4 districts, and food hygiene is part of that. So that was the policy influence as well. I got the CRE scholarship. That was fantastic. And then the CRE scholarship made me, offer me an opportunity to sort of design an intervention and implement it. In terms of financial support, and in terms of like my exposure with the academia and my exposure with around the world to share the findings. And CR made me that was a huge support and contribution from the CR consortium. I really need to thank CR. Defeat and WaterAid also co-funded, so all of them I'm really pleased with all of them. I'm currently working as a technical support manager for hygiene at WaterAid, in UK, based in London. So I sort of lead the technical side of the hygiene programming for WaterAid. WaterAid is one of the charity organizations, works in multiple countries, around 26 countries around the world. So I'm very privileged to work with WaterAid at the moment.